Good morning, everyone. We are good to get started. And for those of you watching online, welcome to the live stream. Thank you so much for joining us at the Regional Environmental Health Summit for Tribes in Arizona and in the Southwest. We are really excited to be able to offer this day and a half of content and learning with and for the tribes in this area on environmental health concerns. We're really appreciative of our federal and state partners who really made who really helped us put this summit together. We're going to get things started in a good way. I'm Brett Weber. I'm National Indian Health Board's Environmental Health Programs Director, and I would like to ask a volunteer in the audience to lead us in an opening prayer, if anyone feels moved to do so. All right, please. Thank you very much. Shrinda, are you introducing the opening speaker? All right. Well, thank you so much. And I'm really looking forward to this summit with all of you. Thank you.
Good morning, everyone. Shrinda Buchanan. I serve as Director of the Office of Priority Projects, Innovation and Environmental Justice at CDC ATSGR's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry, and also serving a dual role as Director of the Office of Environmental Justice at the Department of Health and Human Services. I am so pleased to see all of you this morning. Thank you so much for joining us. It promises to be an exciting day, especially with you with us. I am happy to introduce our new director at our National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry, Dr. Ari Bernstein. I wanted just to read a little bit of his bio before we get started. Welcome, Ari. Ari Bernstein serves as Director of the National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. Prior to joining NCH-ATSDR, Dr. Bernstein led the Center for Climate, Health, and the Global Environment at the Harvard T. Chan School of Public Health and practiced pediatrics at the Boston Children's Hospital for nearly 20 years. Dr. Bernstein is an internationally known leader in children's environmental health, having spent his career to ensure that all children can grow up in environments that enable them to live up to their full potential. His scholarship has explored a broad range of subjects, from toxic exposures to mercury and air pollution, to global environmental changes such as climate change and the loss of biodiversity and their effects on health and health equity. Dr. Bernstein has held many leadership and advisory positions. He has served on the steering committee for the National Academy of Medicine's Action Collaborative on Decarbonizing the U.S. Healthcare Sector, chaired the American Academy of Pediatric Council on Environmental Health, was an advisor to the Dalio Center for Health Justice at NYP, and was a member of the Board of Scientific Counselors to the CDC's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. After receiving his bachelor's degree in human biology from Stanford University, he received graduate degrees in medicine and public health from the University of Chicago and Harvard University, respectively. He is a recipient of the Stanford University's Firestone Medal for Research and a Harvard University Zuckerman Fellowship. Let's hear from Ari. Good morning.
Good morning, Dr. Buchanan. Thank you for that kind introduction. And thank you, everyone, for participating in this summit. I wanted to give some brief remarks and start by telling you a little bit about me. Dr. Buchanan mentioned some things about me, but I wanted to let you know that I grew up on the lands of the Bodowadmi, the Ho-Chunk, the Miamia, and Ochete-Chacoin tribes on the shores of Lake Michigan. When I was a kid, seeing the world around me as a child would, I saw emerge from shadows the peoples who'd lived in my homeland before me. I heard it in the names of our towns, Chicago, Algonquin for Chicago, Winnetka, which in Bodowadmi means beautiful place, and of course, the name of the state, Illinois, which is from the Illiniwek and means best people. I found arrowheads buried in the earth of my grandparents' backyard and marveled at mature trail trees that as saplings had been strapped to the ground to mark the path from Chicago to Green Bay, Wisconsin. As these trees grew, they gained metaphorical power. They embodied the idea of path dependence that I would one day use with students at Harvard. The idea of path dependence speaks to how we shape living beings, from trees to children, in their earliest days, and how it strongly shapes their final forms. A property of extraordinary power as we think about the embedded challenges we face on all sides in today's world. As I grew up, I came to learn why these places I knew and sounds I heard were but shadows of their former selves. I, to this day, am angry and can only imagine the anger you must feel. And I am also embarrassed to know that so many of the places from my childhood commemorate people bent on destroying Indigenous people and culture. Fort Sheridan, where the most soldiers were discharged from service after World War II, including my grandfather, and Sheridan Road, are named after a bigoted man who professed the only good Indian is a dead Indian. Then there are the appropriations of Indigenous countenance and culture. Our city's hockey team, the Blackhawks, is one of the few remaining professional sports teams that persist in caricaturing Indigenous peoples. I am pained both at these realities and at their persistent invisibility to so many of us. I could go on, but I won't, because I know I don't need to tell you any of this. My younger years showed me all that we have lost, but I have come to know and see the strength in what remains. If we are concerned with resilience, how can the many tribal nations that have endured to this day against extraordinary odds not inspire us? You know, and I know that Indigenous peoples of this continent and from around the world embody resilience and sustainable existence. In the past few years, I've heard so many people assert that we have to learn more from Indigenous peoples and cultures, that if only we could follow from the practices of your ancestors and how they followed the wisdom that comes from attunement to the natural world that governs us all, we would be better off. And I admit that when I hear this idea, I bristle, because I believe that we, the descendants of Europeans, have no right to that knowledge. we have no moral standing to claim it as our own. Yes, I absolutely believe we could create a healthier, more just, and sustainable world if we learned from the wisdom of tribal ancestors. But that is a path that we must earn an invitation to. I beg your forgiveness if my childhood recollections here seem misplaced, but I recount them because I want you to hear from me that I understand some of what this country represents to you. And while my knowledge of your peoples, your histories, and your lifeways is wildly inadequate, I am committed to doing what I can, so long as I have the position I'm in, to hear from you, to find solidarity with you, and to promote the cause of justice for Indigenous peoples. Our gathering today emphasizes one part of that cause, environmental health equity. I am enormously honored that you have decided to join in this summit. I take it as a sign of your belief in our ability to contribute meaningfully in the quest to protect your tribes from pollution, climate change, and other risks that disproportionately affect them. But even more so, a belief in the ability of tribes around the country to be your own best mentors, allies, and supporters. I hope we can earn our place to be learners to the wisdom you have to offer, and once again see the world with a child's eyes. That we can earn the right to be your partner, that you will one day, I sincerely hope, see good among your peoples for the time you have taken here. In Bodwani, Miigwech. Thank you.
Thank you, Dr. Bernstein, and good morning, everyone. I am Donata Green, and I am with CDC, and I work in the Office of Policy Planning and Partnerships within the National Center for Environmental Health and Agency for Toxic Substances and Disease Registry. Before we get started, I think it would be a good idea. I'm going to give you an overview of day one and then introduce our first speaker and the topic for the first speaker. But before we do that, I'd like to hear more about who you are and why you are with us today, and just get to know one another, because we're for over the next day and a half, today and a half day tomorrow, we'll be learning more about each other, some of the work that we do, and how we can connect with each other after the summit is over. So can I ask NIHB, do we have a handheld microphone? All right. So I'm going to put you on the spot and pass around the microphone. And if you can introduce yourself, let us know who you're with, and what brought you here today.
Hi, is this working?
Say something else.
Hello? Okay.
I think we can hear you.
Okay, hi, I'm Nikki. I'm with the Arizona Department of Health Services in the Environmental Health Office. I'm here today to learn more about what are the environmental health issues that tribes face.
Welcome.
Hello. My name is Maya Davis, and I also am with the Bureau of Environmental Health Services at EDHS. And I'm here to also with Nikki learn about the environmental health services and about what we can do.
Welcome.
Hi, my name's Emily Albert, and I work alongside Maya and Nikki at the Bureau of Environmental Health. I am an intern, so why I'm here today is to expand my perspective on these issues and see how I can further learn to help different populations.
Hello, everyone. My name is Nathan Lothrop. I'm an assistant research professor at the University of Arizona down in Tucson, and also the associate director of the Western Environmental Science Technical Assistance Center for Environmental Justice, or West EJ Center. It's a mouthful of a center name. And so I'm hoping to be here today to hear more from everyone else who's working on these complex and important issues, and also connect with people at the same time.
Hi, my name is Paloma Beamer. I'm also a professor at the University of Arizona in the College of Public Health, and I'm the director of the new West EJ Center, which just got funded in June. It's one of the EPA Tic Tacs. But I also direct the Community Engagement Corps for the Southwest Environmental Health Sciences Center, which just got funded for its 30th year here in Arizona, and so have a long history of working with tribes and along the border on both sides.
Good morning. I'm Mazda Shirazi. I'm Medical Director of Arizona Poison and Drug Information Center. I'm here to learn about the needs of tribal nations and what we can do to provide them with the assistance through the Poison Center so that they can take care of the healthcare needs of their members.
Good morning, Melissa Fulton with the Intertribal Council of Arizona, Inc. Tribal Epidemiology Center. I'm the vaccine epidemiologist. What brought me here today is, to learn more how the environment affects the human body as well, and how it can supplement, or how vaccines can also supplement the human body and health.
Good morning. I'm Dr. Jamie Ritchie. I'm the Tribal Epidemiology Center Director at the Intertribal Council of Arizona. I've been in this role for about 11 years. We do have some funding through the Indian Health Service that does allow for environmental work with our tribes. Our organization is very involved in tribal water, environmental air quality, solid waste, and of course, I'm very interested in that intersection with disease as well, to work with our communities to support their good work and their health departments in this area as well. Thank you. Good morning.
Good morning. My name is Jamie Leger. I'm from CDC, the Office of Financial Resources, Office of Grant Services, and I'm here. I'll be talking a little bit tomorrow about grants services within CDC, but I also want to listen and learn from all of you in the community about how we can partner more with our centers at CDC and do better in this community.
Hi, my name is Ria Schandelmeyer. I also work at CDC in the National Center for Environmental Health and Agency for Toxic Substances and Disease Registry. I'm in the Office of Priority Projects, Innovation, and Environmental Justice, and I am here to make connections.
Good morning, everyone. I'm Troy Ritter. I'm the water system subject matter expert for CDC's National Center for Environmental Health. That work involves a lot of water-related disease outbreak response, some disaster response, but also a good part of my work involves working for tribes and working with the Indian Health Service to address water-related issues. Before coming to CDC, I worked for Indian Health Service for 16 years. Thanks.
Hey, good morning. My name is David Kramer. I'm the director of the Division of Environmental Health Services for the Phoenix Area Indian Health Service. And I wanted to see how we could support this initiative. I just retired from uniform after a 30-year career with Indian Health Service, and now I'm a civil servant. And so, but I've worked in Phoenix for the last 20 some odd years. And then before that, Pine Ridge, South Dakota, and Bethel, Alaska, and Fort Duchesne, Utah. So we're here to support. And so just looking forward to how we can assist this initiative. So thank you.
Good morning. I'm Laurel Berman. I'm with the agency with the long name, Agency for Toxic Substances and Disease Registry, ATSDR. People very frequently say ASTDR, and we have to say we're not the STD program, but we do believe in holistic health. And I'm here, I do a lot of land reuse work. We call it brownfields to health fields. Work in tribal areas, pretty much work in rural areas as well, and work across the country to integrate community input and vision in redevelopment plans with the goal of improving health outcomes. And I'll be talking about this a little bit tomorrow. I'm happy to be here.
Good morning, everybody. My name is Tammy Balone, and I'm here from Albuquerque. I am the Director for the Environment Department with the 8 Northern Indian Pueblos Council, and we are a consortia that works with all the tribes and pueblos in New Mexico, as well as Isleta del Sur in El Paso, Texas. Being that I see down here mining and, climate change and things like that, that's exactly what our office does. And, I want to tie it to environmental health, learn a little bit more so I can take information back to my member tribes. Thank you.
Good morning, I'm Ned Johnson. I'm the National Indian Health Board's Communications Director, so I'm here in support of the summit. Thank you.
My name is Anthony Phillips. I work with the Salt River Pima Maricopa Indian community. I'm an environmental health technician, so just here to learn.
Good morning, Yate Pena. I'm Denise Bartley with Northern Navajo Medical Center, IHS, out of Shiprock. I am the program director for 2 of the uranium programs that we house out of Northern Navajo Medical Center, and I'll be talking about those a little bit later today. Thank you.
Hello, everyone. Good morning. Yes, my name is Marcia Gray Eyes. I am from Shanto, a small community on the Navajo Reservation. I'm the VP of my community, so I came out here just to learn a little bit more about environmental health and justice. It affects all communities. So I'm looking forward to this summit and actually excited to be here.
Thank you. Good morning, everyone. I'm Shay. Hello. Yay, it's that yoga stretch this morning. Oh, I need to do it on both sides. Oh, yeah. Beautiful day here in Phoenix, and thank you very much for the opportunity. I am the acting, it's the theatrics of Indian country, right? Acting director of the Office of Tribal Affairs at CDC. I gave you cards. If you don't have cards, please, you want more cards? They gave me a lot of cards. I'd like to give you a lot of cards, so that you can help your network have the point of contact for CDC's Office of Tribal Affairs. My relative here said that he was here to learn, but I think the most important part for me is to learn from all of you. We all have expertise and we all have understanding of our communities at a different level than at the federal level. And it is only through that collaboration and partnership that we will be able to make forward movement into better health, because whether it's housing or whether it's clean water, clean air, clean land, and our ties as Native peoples to our land is part of our cultural protective factors. So I think that as all things in Indian country are circular and connected, that so is this, and so are all of you in this room. So thank you so very much for coming, for your wisdom and sharing your knowledge with all of us here today. So thank you very much. And if you need more cards, please.
Yate Bennett, everybody. My name is Tashina, and I am coming from, my hometown is Cameron, Arizona. It's on Western Navajo, and it's a good day to be here with everybody. I am a multicultural communication specialist with a consulting firm called ICF Next, and let me see what else. Oh, thank you. Oh, sorry. And I know we're also virtual, right? So I'm hoping that there's some more tribal people online. So I encourage the people who are online to share with all of these amazing folk all of your problems so we can get some funding. Yeah, so I am happy to be here, and I feel like I'm missing something, but I'm a Navajo person. And my background is in public health, and I am passionate about environmental health. So I'll pass on.
Thank you. I had a brief opportunity just to introduce myself earlier, but I just want everybody to know I'm an environmental scientist and environmental epidemiologist by training. I've been working at the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry for almost 34 years and have had the pleasure of working with a number of my colleagues here as well. I just wanted to say, and I also mentioned the fact that I'm serving as interim director of the Department of Health and Human Services new Office of Environmental Justice. And I heard the terms justice and I heard the terms health. And I always like to say that environmental justice and health equity are inextricably linked. For far too long, many of our communities of color, our indigenous brothers and sisters have really suffered from a lot of environmental injustices, particularly with that connection to the land and the connection to health. Those are inseparable. So for us to be here and be able to learn from each other, as Shay says, we're here at the federal government, we have presentations that we're presenting, but we also learn from each other. We also want to learn from our tribal brothers and sisters as well. So as we think about today, ultimately, what do we all want to be? We all want to be healthy, live in a pristine environment, again, because those two things are inextricably linked. So I think the opportunity for us to come together now and in the future, and as much as we possibly can, is so very important so we can connect and learn from each other. As Shay always says, it's all about relationships. And that's what we want to do, build relationships, learn from each other, and just enjoy each other for this particular time. So I'm happy to be here. Again, as I mentioned before, Sharonda Buchanan, had the pleasure of working with Troy for a very, very long time. And so I just think we're in for a treat just this whole day. Just respect the grounds and the place where we are as we think about the tribal injustices that we want to find solutions to. So thanks.
Hi, everyone. I'm Brett Weber. You've already heard from me. I'm National Indian Health Board's Environmental Health Programs Director. As NIHB continues to build out our environmental health work, I'm our first environmental health director. So it's kind of a new space for us to be working in. We're expanding our public health work and hoping to create resources and things that are really helpful to tribes in the environmental health front. So I'm really looking forward to hearing from the tribal folks about what issues that are impacting their communities and what resources would be most helpful. So thank you.
Hello, everyone. Audrey Dowling, Public Health Analyst with CDC's National Center for Environmental Health and the Agency for Toxic Substances and Disease Registry. I'm happy to be here. I work along with Dr. Donata Green and Dr. Sharonda Buchanan, as well as Rio Shanmar that's in the back. And I am happy to be here. I'm here to learn and to hear and support. So if you need anything, let me know.
Thank you. Let's see, I don't want to leave out, I think, two very important people who helped put all of this together. Leanna, and I know you are multitasking over there, so if you want to raise your hand, and then Eliza is at the registration desk out front. So I want to give a big shout out and thank you to the two of them for helping to pull all of this together. Let's see, I'll try and get us back on schedule as much as possible, but that's okay if we're off schedule a little bit. For today, you're going to actually hear from Shay Welch in a second to talk about our tribal public health data site. So she will share with us some information about the data site, what all you can do with it, what data you'll be able to access, the types of technical assistance training that can be provided as a result of working with the data site. Then we will have a break. After the break, we will have a resource panel. And from that resource panel, we will hear from Dr. Beamer, Dr. Mazda Shirazi, and Troy Ritter to talk more about some of the resources that are in the area and how you can access those resources. And then after the resource panel, we'll have a networking session where you have the opportunity to speak with us or anyone that you have heard from or maybe not have heard from and would like to learn more about on a one-on-one basis. And then we'll have lunch After lunch, we'll have a presentation on mining and tribal community health. And then we'll have another break, and then we'll hear more about climate and health, climate change. And then we will wrap our day up around 4:30, 4:45. Let me ask Rio, do we have any comments in the chat from our virtual participants? So no comments in the chat. Thank you very much. So at this time, I'd like to introduce Shay Welch, who you just heard from a second ago. And Shay is, again, with CDC. She is the acting director of the Office of Tribal Affairs and Strategic Alliances. Her tribal affiliation is Blackfeet, and she has worked with tribes for over 30 years. So Shay, please come up. You don't have to eat. This is informal, so.
I always find it very peculiar to be up and looking down. So let me ask you to forgive me for this posturing that somehow I am higher than you when I am not. We are all together. But I do have some really cool information to share with you. Before I get into the slides, I love doing these little 30-second videos on my phone about, and we'll maybe do them later this afternoon or tomorrow morning, about why is this summit important? What did you take away? How do you encourage others to come to these environmental sessions? So I'm part communication, part get together, part, come on. It's all about what's at the bottom of this slide: people, services, and systems. Next slide, please. So this is our organizational chart. Looks like a very odd logic model. Not very much logic. If you look at it in terms of flow, as we normally know a logic model to be, if this, then that, and if this, then that. But there in the center is the immediate office of the director. On your bottom right, where there's a little red star, is a new center. Most of you have probably heard that CDC went through a reorganization, and we are still going through that reorganization. It was like a prearranged marriage, if you will think of it that way, right? Where you have the bride and groom, or the groom and bride, whatever the case may be, and two families coming together. So these new centers emerged, and we're still trying to figure out, and it's very different than it is in Indian country in our ceremonies and our ways, that we know what our roles are when we have clans come together or families coming together. We have to figure out who's doing what and how, including every single employee in this new center has to have a new position number, obligation number. I would never want to be in HR because they are just swamped, right? Just absolutely swamped. So we have this new center called and this is a very long name too, the National Center for State, Tribal, Local. Oh, you got to go back because I need to read that whole thing. National Center for State, Tribal, Local, and Territorial Public Health Infrastructure and Workforce. And what we really call it is PHIC, Public Health Infrastructure Center. I would have gone with PHIW, because by the time you get through saying that whole name, it's like, phew, I got through it. Next slide, please. Within that center, we are, our focus is being committed to ensuring that every community enjoys the benefits and protections of effective public health services. Next slide. Now, here is the organizational chart within that center, and I get to be in the red box. That is the Office of Tribal Affairs and Strategic Alliances. The Office of Tribal Affairs and Strategic Alliances, AKA OTASA, is responsible for all things tribal across CDC and ATSDR. ATSDR is a sister agency, but we're connected. We're all the same, if you will. We have different focus and scopes. So anything to do with Indian country, it's that office. It's Office of Tribal Affairs and Strategic Alliance. Whether it is listening sessions or consultation or visits or these environmental health summits, we are always happy to support anyone in Indian country. Now, if you think about that, what I call the ill-designed logic model, which was our organizational chart with the immediate office of the director, you can see how far down the Office of Tribal Affairs actually is within CDC. Now I got some heartburn about that because it's all about government to government relationships. And as an American Indian, I understand that. That's in my DNA. That's how I was raised. Everything to do with anything in Indian country is really legally based. Whether it's treaties, policies, rules, Supreme Court rulings, Federal Circuit Court rulings, it's all legal. Government to government. Just like in my home office, since I'm on detail, I'm in the Global Health Center, and I work with international countries like Tanzania, Mozambique, Thailand, Vietnam. They're all sovereign governments, just like our 574 federally recognized tribes are sovereign nations. Next slide, please. So as you can see, this is what I just talked about on what OTASA does. And we are the resource specifically designed to serve tribes and tribal partners. Tribal partners are not only tribal serving organizations, our tribal epicenters, but they're also national organizations such as National Indian Health Board, National Council of Urban Indian Health, and it just area Indian health boards, and so forth. We also work with states, governors, tribal liaisons. Next slide, please. It is essential to have this public health and tribal sovereignty. And there's not a lot of people who understand the nuances and complexities of Indian country. I mean, think about it. Where do people learn about us? K through 12, public schools, movies, besides Smoke Signals, which was still like one of my favorites, right? Dances with Wolves, were cartoons. If you ever just Google American Indian, and you will come up with these images, a huge number of images that are historical. They're black and white, as if we do not exist today. We do exist today. And the new director of the Center for Environmental Health said one thing that was very important, and he recognized that the US policy of the only good Indian was a dead Indian. But we're here still surviving today despite the trauma. And it's not just historic trauma, it's our trauma today. It's our opioids, it's fentanyl, it's tranq, it's suicide. I mean, how does an 8-year-old get to the point that they feel that their back is so against the wall that they have to kill themselves? That is public health. And when we look at the root causes of some of these things, we get into our National Center for Injury Prevention and Control, which has subject matter experts about adverse childhood experiences, children in Indian country going in and out of foster care, and the trauma that causes. And we know We, as a scientific agency, optive of Health and Human Services, not only does CDC know, NIH knows, our academia partners know that the more trauma we have as individuals, it literally changes our DNA. And we continue to pass that trauma along. So we have data sets. Next slide, please. Go ahead. We have data sets, but CDC does not collect data. There's a big difference here, and I ask for your attention on this. We do not collect the data. We receive the data from states. The states give us the data. We are a repository for the state data. But we, for a long time, did not share that data, despite whether it is accurate or inaccurate, because of course we have a lot of misclassification. State of California is an example. Under the Treaty of Guadalupe, the indigenous peoples were transferred to the United States as if we were commodity. A number of the California tribes' last names, and here in Arizona as well, last names, surnames being of Spanish, maybe Gonzalez or Gomez or Jimenez or Frias, etc. And many people, when they access care, they look at me as an example, and they see the last name Welch, and they look at me and see Caucasian, because our minds trick ourselves. They don't ask me. They assume. And yeah, I get it. That person who is registering us for whatever that service is in the county public health system or wherever, they've got a long line behind me and they're trying to get me registered for my visit. And they just check the box. So we have a huge amount of misclassification under race and ethnicity. We also have several states that don't even include race or ethnicity data. In March of 22, I mean, think about it, 19, we were just starting COVID. 2020, 21, 22, that was all a blur. But in 22, the Government Accounting Office, that's what GAO is. GAO is an office within the federal government in DC, and they investigate an item, a topic, at the request of Congress. They're different than the Office of Inspector General, but the Government Accountability Office was requested to look into the issue of tribes and techs, tribal epicenters, not being able to access tribal data generated or compiled from other sources, because remember, we are a repository from CDC. But if we're the repository, why can't tribes and tribal epicenters receive the data? Data equals dollars. Data also is used to drive decisions. I used to run federally qualified health clinics for tribes. One of the largest ones was in Riverside, San Bernardino County, where we had 13 satellite clinics, and we had, it was a consortium of tribes. And one of the things that I learned very early on is that when we are writing for grants, or whether we are determining what programs in the next 2 to 3 years do we need, we always would have to look at our data. So before we had the Indian country special diabetes program, I would review the data and say, wow, we have a high obesity rate. Wow, we have food insecurity. Wow, we have the access to food is to sugary sodas and potato chips and looking at our economic income per household, what else are they going to afford? And location of fresh fruits and vegetables and etc. So we knew darn well that we had to plan for more diabetics, type 2 diabetics, based upon data. Data also gives us information when we are, grants, contracts, not contracts, but grants and cooperative agreements, or what we refer to as COAGs, which means we're partners. 50% we do, 50% you do. We have a cooperative agreement to carry out whatever our scope of work is. We're always having to put in the data from the perspective of our glass is half full. What is wrong? Always, what is wrong? What is wrong? What is wrong? What is wrong? But the GAO came in and they did a detailed review, and they issued their report. And so we consulted with the tribal epicenters in October. In December, we launched, and it's still an ever moving and breathing kind of data website, if you will. Next slide, please. A little bit of timeline there. So what we came up with, and this is still not perfect. I don't think it'll ever be perfect, but facing outward, we now have a website where you can go to at CDC. It's called the Tribal Public Health Data, and we're going to click on that link in just a minute. And you fill out the form and you say, this is the time frame I want the data. This is the subject matter or the topic, such as STDs, or could be anything, right? Whatever. And then that form automatically gets routed to the Office of Tribal Affairs and Strategic Alliances. We receive it, we catalog it that it's received, and then we send it to one of our centers or offices that have that particular data. So CDC, as you saw in that organizational chart, has a number of centers, right? Center for Environmental Health, the NCCHSTP, LMNOPQ, all of those, which is really domestic HIV, AIDS, and STDs. We have the Global Health Center. We have so many different centers. So we in OTASA are the pivot point and say, oh, they're asking for this kind of data that goes to this center. So the onus is on OTASA to make sure it gets to the appropriate center based upon your request. What are you asking for? Then we work with that center to make sure that they respond to you. Now, this is not quick. And we're working on ways to speed it up and to make sure that that center acknowledges, Shay, we have received your request just as an acknowledgement. Thank you very much. It may take 45 to 60 days, but we will get back in touch with you, because I'm all about the onus being on the federal government to keep the tribes or the requester up to date, and not what I had to do when I was running tribal health clinics is keep saying, is there any update? Is there any update? This has been 4 months ago. I requested this. Any update? I did a FOIA. This is a little side note. And I did a FOIA request at one of those health centers that I was working for tribes. And I did a FOIA request, Freedom of Information Act. 4.5 years later, 4.5 years later, I received a letter acknowledging my request from 4.5 years earlier. I framed it. So as a tribal person, it's highly infuriating to me that we put so much burden on our tribes and our tribal epicenters and our tribal partners to continuously follow up with us. Where is the concept of customer service? If you call Verizon or T-Mobile or AT&T, pick one, any one, and you press 2 and then press 3. And then you're on hold, and then just the person answers, and then you're disconnected and you start over again. I don't want that to happen to us. So if you will be so kind, and thank you AV staff for all of your support, can't do this without you. If you will click on that link, tribal public health data in that slide, we will go to the actual website. Yep, just click on that. Clink, clink. And while that's loading, while they're doing their thing to get that to load, again, this is, you know, an initial reaction to that Government Accounting Office report. It's not near what you want it to be. Oh, that's way cool. That's a, wow. Look at that. That's like the runways. I was on like 5 runways yesterday to get here. That looks like a runway. Woo! That's all of those icons going on. So anyhow, my point here, while that's loading, is that this is an initial way for us to start to respond. It's also an initial way for us to start tracking the requests. It is also a living, breathing document, and it's a living, breathing standard operating procedure. So we're finding glitches and we're trying to fix those, but we ask for your input. We ask for your input. Did you go to our data and stats? Mosquito bites. Geez, we got a lot of malaria going on in Texas and Florida. We have communications going out to the states about that. And I say, can we communicate with the tribes? We have tribes in Texas. We have tribes in Florida. Anyhow, this takes you to a website form. You fill out the form, you ask for the data. Now, one of the challenges here is that you cannot, stay there for just a second, if you would. You can see here's the guidance on how you access guide for tribe and text, and then tribal public health data request form. The 3rd bullet point down, tribal public health data request form. If you will click on that. Yep. Tell them no, no, thank you. I'm not giving you any feedback. Keep on scrolling down. And this is the form, literally. You put your name, your phone number, stop right there. Your affiliation, like you're Blackfeet, or you're the Intertribal Council of Arizona, or you're Salt River, or whatever. And then you indicate just your data request. Tried to make it as simple as possible. I want all the data for the state of Arizona for STDs. Or I would like all of the data for South Dakota for diabetes, or, right? And then after you fill that out, then at the bottom, you're gonna click submit. That's as simple as I possibly could have gotten it down to be. Now, a couple people wanted their own tribal data. So Blackfeet, I'm just going to use my tribe as an example. This is just a made up example. Requested information for Blackfeet, but we don't have the data for specific tribes because, again, Where do we get the data from? Say it with me. States. There's a number of states that do not collect just general race and ethnicity, let alone tribal affiliation. Indian country is very complex because of all those rules and court rulings and treaties and who owns the tribals entities data, the tribe, because they're a sovereign nation. So do we have a data use agreement with that tribe? Can we release, even if we had the data for Blackfeet or Crow or Gila River, pick a tribe, pick any tribe of the 574 federally recognized tribes, do we have that data when we get it from states? And if states don't collect it, we certainly don't have it. But if states did collect it, can we actually release it without having a data use agreement in place with that tribe? It's very complex. It's convoluted. But tribes and tribal epicenters, public health authorities, right? They need data so that they can drive their decisions in an appropriate way. There's a couple other things that I would ask of you, if you would allow me. Please consider providing input on better approaches. How can we improve this data response request? One other thing is that how can we work with states to collect just race and ethnicity? There's also an organization called CSTE, which is funded by CDC. Are you taking my picture? Let me smile. Okay, there we go. CSTE. Now here's a quirky one, and Jamie, you might help me with this, but CSTE, if I get this wrong, let me know. Here is another convoluted and complex thing about Indian country. CSTE can get, they're the gatekeeper of data. And if you request the data by zip codes, right? So say you request for 5 zip codes for the area that you are working with the tribe, and 4 of those zip codes are definitely all tribal members, but the 5th zip code might have tribal and non-tribal people living in that zip code. CSTE, if you are a tribal entity, tribal serving organization, or a tribe, will say, oh, we can't give you that 5th zip code because there's non-natives living in that zip code. Now stay with that part of the story. Turn the coin over. Do it with me. Turn the coin over. Oh, if I'm a non-tribal organization, Shea Welch Consulting, and I say, CSTE, I'd like the data for these 5 zip codes, they give it to me, including the 4 that are native. They don't even ask. Am I right, Jamie? They are not. You're right about that. CSTE is not the repository. They are the gatekeepers. Right.
So I wouldn't necessarily go to CSTE to request information. Do I need a mic?
Yeah,
No.
because we have people
Oh, because
online.
it's recorded, of course.
Well, not
So-
recorded, but we have people virtual.
Oh,
It is recorded.
hi, everyone,
but-
in virtual land. Good morning. So yeah, CSTE is a group that is a nonprofit that epidemiologists can join, that it's a membership organization, and they will make recommendations to CDC regarding data collection and set standards for data collection and information for the states. And then the states provide that data and information to CDC. Now, states are not sovereign nations like tribes. Okay, but states are their own entity and they do make a lot of their own rules and are there to serve the state population. So there's also issues with IT systems not being up to date. So part of the data transfer issue and those sorts of things are based on data systems needing to be updated. That's why I'm really excited about the DMI initiatives that CDC is working on, because I do think they can work with states to start improving some of those systems. In the state of Arizona, our data and information on race and ethnicity is quite good. There are several places on the death certificate and vital records to collect tribal affiliation. That's very, very different than what we see. CSTE, I am a member of that organization as a PhD trained epidemiologist. I attend that meeting once in a while. Again, that meeting is primarily for state epidemiologists like Mr. Ken Komatsu in the state of Arizona. He's also, or was, part of their executive board. One of the things that CSTE offered the tribal epidemiology centers was a seat on their executive board. However, I'd really like to encourage the tribal health directors in Arizona to become very involved within CSTE, because I do think that the tribal health directors can make a big difference to push these types of initiatives forward. I feel like their tribal subcommittee is lacking. And could use some very strong tribal voices on their tribal subcommittee. It's predominantly been state health department folks that attend those meetings.
Thank
And
you, Jamie. So
Sure.
basically, you have not had the experience of my example of flipping the coin. And thank you for encouraging everyone to get involved.
Sure.
I have heard that from several other tribal epicenters.
What do you
the
mean by
challenge.
flip the coin? I don't understand. Could you?
So if you
elaborate?
requested 5 zip codes, 4 of them have natives population. The 5th one has a mix of native and non-native. They will not give you the data for the 5th one because they need permission from the non-natives to give you the data. But when they give a non-native organization the data for the 5 zip codes, they do not ask the native population, can we give the non-native requester the information? So to me, that is a discriminatory practice that we are internally working on and with. I was just wondering about your experience. So thank you for indicating you have not had
Sure,
that
we have state
experience.
agreements, right? With
and,
ITCA. It's
yeah.
a little different.
Yes, thank you. But that to me is a challenge because that too is another way to access data, right? Is through your zip codes and narrowing it down. So this is the form. You can go back to my original PowerPoint. Thank you so much. It's the simplest form that possibly can be. And if you have encountered glitches or challenges with accessing data that CDC is a repository to, please email. And here's another email address. This is like your main email address to reach us, tribalsupport@cdc.gov. And if you'll just write that down, tribalsupport@cdc.gov. At another meeting, an elder who's a teacher said you have to say something 11 times tribal support at cdc.gov, tribal support at cdc.gov. Say it with me, tribal support at cdc.gov, tribal support at cdc.gov. If we all say it, we can only say it one more time all together now, tribal support at cdc.gov. That is your point of contact for all things tribal within CDC. Any questions? Wow, I'm getting really good at these presentations if there's no questions. Nothing else needed about data. Nothing else about CDC and how we touch point and coordinate with sovereign nations, government to government, and tribal serving organizations. Anything online? Nothing online. Thank you very much. So thank you very much. Thank you.
Thank you so much, Dr. Welch, for that wonderful overview. So next on our agenda, we're going to take a little break, a little bio break. We are a little behind on the agenda, just given our late start this morning. So you'll see on the agenda, it's a 15-minute break, but we're going to cut that to 10 minutes. So if we could all be back for 10:32, we'll get the next presentation started at 10:32. So thank you so much.